Hi, everyone. This is Dr. Michael Walden. Welcome to Ask the Blood Detective. Today's podcast is Anxiety Answers. So for those of you who are new to my podcast, welcome. I've been in clinical nutrition or holistic practice for about 30 years, and I currently practice in Chappaqua, which is a beautiful little town known for where the Clintons live in Westchester, New York, about an hour north of New York City. And my website, for your reference, is drmichaelwald.com. So that's drmichaelwald.com. Lots of free content there. And on the homepage, you can search any topic. You can also get the notes for this particular podcast, Anxiety Answers, by simply searching it on the website. And if you go to any podcast platform, you can listen to this show again. Again, Anxiety Answers. Why did I decide to do a podcast on anxiety? Well, probably for a couple of reasons. The most obvious is that we've got about 40 million adults. That's about 18.1% of the United States population that suffers from one or more anxiety conditions, you might say, because there's more than one in a given year. And, again, 40 million or 18%, that's a significant amount of people, which will certainly impact public health. So what I'll be doing during this podcast is reviewing with you what anxiety is. I'm going to start off by answering briefly and succinctly the 10 top questions that I tend to get about anxiety and the medical and nutritional treatments. I'll talk about lifestyle improvements for anxieties. I'll talk about specific nutritional supplements, including dosages, as I mentioned, the regular medical treatments, and also because this is Ask the Blood Detective, where I want you to become your own blood detective. During every single podcast without fail, I will always talk about the relevant lab tests that are helpful for the particular podcast. And today's topic, again, is Anxiety Answers. Now, most practitioners, those that deal with anxiety in the medical arena, would be neurologists, and certainly some internists would provide anti-anxiety medication, and also psychologists. Pretty much those are the practitioners. And then, of course, there are practitioners like myself, holistic practitioners who, and me specifically, you should know, I'm a doctor of chiropractic. I learned quite a lot of nutrition in chiropractic school. I then got my master's in human nutrition at the University of Bridgeport. I'm a dietitian, and I also have a certified nutrition specialist degree, or certification is what that is in the state of New York. And I'm also a life coach. I also have acupuncture treatment. The reason I'm mentioning all of this to you is to give you an idea of what my background is, because I try to pull whatever I can, no matter what the topic or health concern is for my clients, from as many places as possible, including traditional medicine. I did go to medical school. I graduated medical school. I earned my MD diploma, but I decided not to become a licensed medical doctor, but that knowledge is still in my head. So once again, for additional information and to receive your comments, please go to drmichaelwald.com. You can email me at info@blooddetective.com, and you can call me at 914-552-1442. So what is the role of nutrition in managing anxiety? And I should mention at this point that none of the healthcare providers that I mentioned in traditional medicine use nutrition. Even dietitians tend to stay with old dietary concepts. And as a dietitian, I can tell you, we don't learn about nutritional supplements in dietitian courses simply because they don't believe in it. Some nutritional supplements, yes. A dietitian certainly knows about more calcium in a person's diet to help offset osteoporosis. They all know about using iron for iron anemia. They know about giving protein to people, maybe fatty acids. But in terms of detailed education on the use of vitamins, minerals, herbs, the micronutrients, as well as the macronutrients, the macros are protein, carbs, and fats, is very, very little training. So my training as a clinical nutritionist is that I can use laboratory work to figure out specific needs for my clients. So when I try to figure out the needs of a person with anxiety, obviously the term anxiety, whatever term you want to use, maybe it's general anxiety disorder, panic attacks, etc., in order to figure out what a person needs, I must look at their chemistry. I must talk to them for lengthy periods of time, and maybe more than one time. I will have my clients fill out detailed questionnaires to help point me to how to prioritize what foods, nutritional supplements, improvements in lifestyle that I need to make so that person gets what they need for their brand or personal brand of anxiety disorder. In medicine, in traditional circles, there's not a lot of difference paid to these things. There are some medication differences, but nutrition is all about personalization. So back to the question, what is the role of nutrition in managing anxiety? You have to realize just off the get-go that nutrition plays a crucial role in managing anxiety because vitamins, minerals, herbs, all of these are known to affect not just body health, but brain function. And anxiety does sort of live in the brain in our interpretation. So a balanced diet, whole foods, lean proteins, heavy protein breakfast. We'll learn more about why that is in a minute. Healthy carbohydrates, healthy fats. The brain is composed mostly of healthy fats. And plenty of fruits and vegetables that can positively impact anxiety levels. I suppose I should give you a disclaimer at this point that nutritional and natural means are not considered a substitute for the standard of care for managing anxiety disorders in traditional medical circles. That doesn't mean there isn't evidence to suggest that nutrients help anxiety. There are literally thousands of different articles, some of which I've referenced at the website at drmichaelwald.com. But medicine and medical schools have very little nutrition training. The last time I checked, the average medical school had about 27 hours of nutrition. And according to a very interesting quote out of Harvard years ago, they said that the average individual, I'm paraphrasing, the average individual who watches television commercials about food probably knows more about nutrition than their doctors. I mean, not even gastroenterologists get nutrition training except in gluten and gluten removal. That's it. Next common question that I get, can specific vitamins and minerals help with anxiety? Yes. Certain vitamins and minerals have definitely been linked to reducing anxiety symptoms. Those are the B vitamins, magnesium, calcium, omega-3 fatty acids. Question 3, what I'm doing right now, by the way, everyone, is I'm quickly going through about 10 top questions so you get oriented to, oh, wow, so I know nutrition works. I should be thinking of omega-3s. I should be thinking of magnesium. I should be thinking of calcium. I should be thinking of a balanced diet. That's how far we've gotten already in just 3 questions. And then I'm going to delve into a little bit more practical detail about all of these as the podcast progresses. But how does a healthy diet affect the body's stress response? Because anxiety essentially is a stress response, everyone. A healthy diet can help regulate the body's stress response in a couple of important ways. One is that by maintaining a balance of neurotransmitters such as serotonin and dopamine, which are crucial for mood regulation. So consuming a diet rich in antioxidants can also help reduce oxidative stress, which is associated with anxiety disorders, and also can improve one's general sense of well-being. And interestingly, concerning antioxidants, is that oxidative stress is considered one of the most probable theories as to how human beings age through oxidative inflammatory changes. So having antioxidants helps to offset the aging process. Another very common question I get is, Dr. Wald, they'll say, can caffeine intake affect my anxiety levels? You need to know that caffeine is a central nervous system stimulant. That's why most people take it to get a boost, to get an energy boost. And it helps to stimulate the adrenal glands and other physiologic mechanisms in order to do that. But caffeine can exacerbate anxiety symptoms in some susceptible individuals. So I always have them eliminate, if it is a long-standing case of anxiety, eliminate all caffeine, switching to decaffeinated alternatives, although they tend to contain about 10 to 20% caffeine, or I might go to teas. And by reducing the caffeine and reducing that as a stimulant, that should help alleviate some amount of anxiety for those who are susceptible to caffeine triggering their autonomic nervous system stress response. Question 5, what's the relationship between sleep and anxiety? So sleep, as you might imagine, plays a vital role in managing anxiety because poor sleep quality exacerbates anxiety symptoms by reducing one's ability to cope. It's just like if you're tired during the day and then you have to do your regular daily routines, but they seem to be affecting you more because you didn't sleep well. It's as simple as that. So I always encourage my clients to establish a regular sleep schedule, creating a relaxing bedtime routine and ensuring a comfortable sleep environment, which can help improve sleep quality and reduce anxiety levels. There's a lot more I can go in about sleep, but we'll have to save that for another presentation. In fact, I will be doing a podcast on the topic of sleep pretty soon. And the next question is, are there any medical treatments for anxiety? Which sounds like an odd question. I mean, it's so obvious. But I have clients that just don't know any of the treatments, and they've had conversations with their family practitioners or their internists, and there's just not a lot of education. So yes, there are various medical treatments available for anxiety, including selective serotonin uptake inhibitors, or SSRIs, serotonin norepinephrine uptake inhibitors, otherwise known as SNRIs. There's benzodiazepines and other anti-anxiety medications, and the right one for you will be chosen based on the clinical experience and the medication guidelines of whatever practitioner feels that that's important to prescribe for you. So it is essential that you consult a healthcare professional qualified to determine the appropriate medication options for you. Question 7, how do therapy and counseling work with anxiety? Therapy and counseling can help lots of individuals develop coping strategies and resiliency to manage anxiety and overall stress. There's cognitive behavioral therapy, which is known as CBT. Very useful stuff. I think it's brilliant technique. It's a common approach that focuses on identifying and changing negative thought patterns and behaviors that contribute to anxiety. Probably I'll mention more about CBT on other podcast episodes. And the reason that you'll start to see CBT throughout a lot of my podcasts, even if it's just a brief mention, is because to me, the fundamental tenets of CBT get to many of the roots of our what we call cognitive distortions or improper thinking, which can exacerbate and cause unnecessary anxiety, not to mention many other health problems. And then people see me because they ask the question to themselves, are there any complementary, holistic, alternative therapies for anxiety? So there are. Complementary and alternative therapies include mindfulness-based practices such as meditation, yoga, deep breathing exercises. And additionally, there are herbal remedies like lavender, chamomile, valerian root, which may help some individuals manage their anxiety symptoms. And the 9th question I get most popularly is, can exercise help with anxiety? And that's a big yes. Exercise is very essential for certain individuals where if they don't exercise, they're an emotional mess. Obviously, they need to continue to have exercise in their lives, probably definitely at regular intervals, maybe even at regular times during the day, because we know that exercise, particularly in a routine, along with anything else that a person does when in a routine, tends to be associated with improvements in anxiety overall. And there's aerobic exercises such as walking, running, swimming. They stimulate the production of endorphins, which can improve mood and decrease anxiety. And if you really like anxiety, if you generally like, not anxiety, but exercise, then that will help you produce dopamine, which is sort of a happy neurotransmitter. And the last most common question I get is, what is the role of support networks in managing anxiety? So support networks include family, friends, and support groups. They can all help individuals with anxiety by providing emotional support, encouragement, understanding. And these networks can also help individuals develop coping strategies and maintain accountability in managing their anxiety. Okay, quick break just to give you my contact information. You're listening to Ask the Blood Detective. Today's topic is anxiety answers. You can reach me by phone by dialing 914-552-1442, emailing me at info@blooddetective.com, and going to the website at www.drmichaelwald.com. That's drmichaelwald.com. So some of you may not have ever heard of the Diagnostic and Statistical Manual of Mental Disorders, but there is a version of that called the DSM-4. Again, Diagnostic and Statistical Manual of Mental Disorders, that's abbreviated DSM-4. It's a widely used clinical guidebook, I suppose is a good way of describing it, that provides standard criteria for the diagnosis of various mental disorders. So anxiety disorders are classified under a category called anxiety disorders, which includes several specific disorders such as general anxiety disorder, panic disorder, social anxiety disorder, and there are several others listed. And the DSM-4 defines anxiety as a psychological state. I'm paraphrasing here as I'm trying to remember it. A psychological state characterized by feelings of tension, apprehension, uneasiness, often accompanied by physical symptoms such as increased heart rate, sweating, and difficulty breathing. And there's many other diseases in my mind that can be caused or worsened by anxiety, the least of which is constipation. That's a very common one. People who tend to keep their feelings inside also can tend to keep their fecal matter inside, which is what constipation is. More on that later. So anxiety disorders are diagnosed when a person experiences excessive and persistent worry or fear, and it's got to interfere with their daily functioning and cause significant distress. And the DSM-4, that statistical diagnostic manual I just mentioned to you, outlines specific diagnostic criteria for all the disorders, which include the presence of specific symptoms, the duration of the symptoms, and the impact of the symptoms on an individual's life. So if you're formally diagnosed with anxiety, there are certain characteristics of your stress response that are similar to others that are diagnosed with the same diagnosis. So one of the most common anxiety disorders, a general anxiety disorder, is characterized by chronic and exaggerated worry, I would say, about everyday life events where things just, from another person's perspective, are fine, just life happening as usual. But in a person with general anxiety disorder, they have an exaggerated sense of worry and stress for life events. And it could last for months, and it has to last for at least 6 months to be diagnosed as someone with GAD or general anxiety disorder. And the person with GAD, general anxiety disorder, finds it very difficult, if not impossible, to control their worry, and this constant state of tension interferes with their daily activities and social functioning. And then there's panic disorder. That's another anxiety disorder described in the DSM-4. It involves, by definition, recurrent unexpected anxiety attacks, which are sudden episodes, I should say, of intense fear or discomfort that peaks within minutes. So it comes on really fast. The person's usually sweating. They might be shaking. The mouths might get dry. These are all autonomic nervous system what they call alarm reaction stress responses. Now, these attacks are often accompanied by physical symptoms such as chest pain. So many people mistake their anxiety attacks for heart attacks. And then what do? Particularly, and any of you out there who suffers from recurrent panic attacks has experienced what I'm about to say. You've gone to the emergency room several times in fear that you might have a heart attack, and they ultimately do EKGs, they do the blood work, and they give you a diagnosis of anxiety. You should realize something here. Although anxiety attacks are not heart attacks, those who suffer from anxiety attacks do have an increased risk of heart attack. And for obvious reasons. The autonomic nervous system is stressed in both conditions, and the heart can only take so much, to put it simply. And in addition to the chest pain as a symptom of anxiety attacks, a person might experience shortness of breath, dizziness, or fear of losing control, or fear of dying. And I do see many of these clients too. They come to me and they're clearly educated, very intelligent, and they have real symptoms that are usually chronic over the years. It could be any type of symptom. And they request that I do extremely detailed workups on them. And those individuals, not all, but I would say the majority of them that I see are suffering from anxiety attacks or general anxiety disorder, and many of them don't even know it. So they have these, you might say, irrational fears of a hidden disease is really what they're thinking. And when I'm honest with them and I say exactly what I'm saying to you right now, you listeners, to the person sitting in front of me, they usually recognize that what I'm telling them is true. And the benefit of that is that they might be able to chill a little bit, take a step back, and then we can have a rational conversation about how we should test. Generally speaking, I will do any tests any of my clients ask of me because I've learned to trust people's intuitions. Now, sometimes a person has anxiety and they have a fear of, let's say, having cancer or some other health condition. They want me to search for it. And sometimes they're absolutely wrong. We rule it out, and that's that. But sometimes the person's actually right. So was the disease actually there hidden and they sort of knew it unconsciously and it showed up as anxiety, as an expression of anxiety? Or did the person's anxiety state over time actually cause the disease, like a self-fulfilling prophecy? So that's something that I have to grapple with. And so I decide to trust people, and I usually do the extreme workouts because I believe people will benefit from actually knowing that based on the best biochemical workups and other types of workups that I can do on a client, that we've ruled out most things that we could possibly test that might be hidden from us. So getting back to panic disorder, people with panic disorder may also develop agoraphobia, an anxiety disorder characterized by an intense fear of being in situations where escape might be difficult or help might not be available. So when I'm speaking with a person, if I'm viewing them through this lens of DSM-4 criteria to see what diagnosis they have in terms of mental health, it's very easy to see these problems. And most of their family members, even intimate lovers and close ones to my clients, they don't see it because they think in their minds, well, this is what the person is. This is who they are. So they don't know how to recognize it. And then there is, you should know that there is the DSM-4, which has been succeeded by the DSM-5, which provides updated diagnostic criteria and, as I mentioned, classifications for mental disorders. So the DSM-5 is probably at least at the time of this podcast is the source to go to. So let's speak about the medical treatments for anxiety. So as I mentioned, just to sort of make sure we're all on the same page, anxiety is a common mental health condition that affects millions of people worldwide. It can be caused by a variety of factors: stress, genetics, brain chemistry are just a few. There are several medical treatments available to help manage and reduce the symptoms of anxiety. So we're going to continue and discuss the most common and effective medical treatments for anxiety. So let's start with medications, because one of the most common medical treatments for anxiety is medication. There's several types of medications that can be prescribed by a healthcare professional to help manage anxiety symptoms. And these medications work by targeting specific neurotransmitters in the brain, such as serotonin that you might have heard of, or norepinephrine, or GABA, which is gamma-aminobutyric acid. That is a really important one for you to know. Gamma-aminobutyric acid. It's abbreviated GABA. You'll find out in a second. So there's like three basic sort of classes of medications, you might say, for anxiety disorders and symptoms. And of course, I prefer to try to work on a person's cognitive distortions and thinking errors and teach them about reframing and use other types of psychological techniques before I drug the person up. But sometimes the person is so far gone, they just can't focus on successfully changing these mental habits that got them to experience such persistent anxiety symptoms in the first place. So thank goodness medications are there. Do they work on everyone? No. But have they saved many lives? Absolutely. If you don't believe in medications, that's perfectly fine, and you have every right to feel that way. I just make it a practice of any of the podcasts, any of the Ask the Blood Detective podcasts, to always cover both the medical and the holistic treatments. And I can only just touch on them lightly because this is only roughly an hour show, but I think it's fair to do that. And then you can choose whatever you'd like. That's called making an informed decision. You should know that certain medications do not work well with certain nutrients, and certain nutrients do not work well with medications. Some nutrients might reduce the effect of, let's say, anti-anxiety medications or antidepressant medications, and some nutrients will actually help nutrients work. And that's something that has to be determined by you and your healthcare provider together, and very carefully considering that. So there is the class of, as I mentioned earlier in the show, the selective serotonin uptake inhibitors, SSRIs. So these medications help increase serotonin in the brain, which can improve mood and reduce anxiety symptoms. Examples include Prozac, fluoxetine, or Zoloft and Paxil. These are just a few. And then there are the serotonin norepinephrine uptake inhibitors, or the SNRIs. So these medications increase both serotonin and norepinephrine levels in the brain and can help improve mood and reduce anxiety symptoms. And some examples of those would be Cymbalta and Effexor. And there is the benzodiazepines. So these medications work by increasing GABA, that neurotransmitter, that commutative, or what they call parasympathetic supporting neurotransmitter, GABA. So the benzodiazepines increase GABA levels in the brain, which help to reduce anxiety symptoms. So there's diazepam and Xanax and Ativan are three common examples. So it's essential to note that while these medications can be an effective treatment for anxiety, it may take, first of all, several weeks for a person to feel the full benefit of these medications. And some medications may have side effects. In fact, they do. So you must consult with your healthcare provider. And if you're interested in the nutritional medication or getting off your meds and getting more nutrition, you obviously need to have a practitioner, a single practitioner, who has advanced knowledge in the medications used for anxiety disorder and advanced knowledge in the nutrients and advanced knowledge in the interactions. You're not going to get those sorts of things from a regular dietitian or a regular certified nutrition specialist. It usually has to be a practitioner that has some sort of doctorate, and preferably a doctorate like mine that allows for laboratory testing, doing physical examinations, and all of that. What about the role of psychotherapy? So psychotherapy, also known as talk therapy, is another common medical treatment for anxiety. It involves working with a mental health professional, such as a psychologist or therapist, to help identify and address the underlying causes of anxiety. And some of the most common types of psychotherapy include the following few. There's one that I mentioned earlier, CBT, cognitive behavioral therapy, which focuses on helping individuals identify and change negative thought patterns and negative behaviors that contribute to anxiety. And this form of therapy has been shown to be highly effective in treating anxiety disorders. I love it. I think it's fantastic, CBT. Read a book on it. I also have quite a bit about CBT on my website at drmichaelwald.com. And then there's something called exposure therapy in psychotherapy. So that exposure therapy involves gradually exposing individuals to the situations or objects that cause them anxiety in order to help them become less fearful and more confident in their ability to cope with these situations. I love exposure therapy. Look, I have a height fear, and I was recently in Japan in some of the tallest towers in Japan. In fact, I was in the tallest tower in Japan. And there was a time in my past I never could even entertain the thought of going up in a tower, let alone a tall building in an elevator. But now I can go in the building with no issues at all. I could stand right at the window looking down, huge amounts of space between where I am and the ground is. And other than sometimes getting a bit of a chill, throughout my body for a second or two, I practiced exposure therapy over the years because I didn't want this phobia of mine to ruin certain pleasures that I otherwise wouldn't have and couldn't enjoy in my life. So I love exposure therapy. It's fantastic stuff. And then there is acceptance and commitment therapy, or ACT. So again, acceptance and commitment therapy. So ACT, or ACT, helps individuals develop mindful and accepting skills to better cope with anxiety-provoking situations and emotions. And as you might imagine, whether we're talking about CBT or exposure therapy or ACT therapy, they can be used in combination to whatever extent an individual needs them. And that, of course, is determined by a qualified healthcare provider. So let's get into a little bit the alternative therapies. I'll start with the lifestyle alternative therapies. And I really hate to call them alternative therapies because they don't have to be used instead of traditional medical treatments. They just should be considered and used whenever it's you deem is important. So, for example, there are relaxation techniques. So practices such as deep breathing, progressive muscle relaxation, and mindfulness meditation that can help individuals reduce anxiety and promote a sense of calm. And what I love about the deep breathing part is not so much the deep breathing, but if someone has anxiety, they're usually hyperventilating a bit. And then they hyperventilate and they don't get as much oxygen out. They don't get much oxygen in, and they don't blow as the proper amount of carbon dioxide out. So when a person's holding in the carbon dioxide, it converts in the body to carbonic acid. And you might think of that as a stress chemical, which causes the sympathetic nervous system to feel anxiety or perpetuate anxiety. So just the mere practice of slowing down your breathing and taking in slow, deep breaths immediately impacts your autonomic nervous system, which, by the way, is the part of your nervous system which controls the automatic functions or the autonomic functions like breathing. And breathing, it's hard to be stressed out when you're breathing slowly. It's just like it's hard to be clinically depressed when you are smiling and dancing. It's just very difficult. Okay. And then there's physical activity. Regular exercise, we know, improves mood and reduces anxiety symptoms. Now, sometimes my clients, they'll be so clever, they'll say, well, Dr. Wald, I hate physical activity. And I used to say, well, not everything that's good for you feels good, which is true, but that's not going to help them develop a different relationship to their exercise. So that's a separate conversation that I have with them as a life coach to get them to embrace exercise. I've been a runner for my whole life since I'm 16 years old. I'm 57 now, and I hated running most of that time until around 20 years ago. And one day I simply decided, I noticed that I was disgruntled over having to run. Poor me. And on these beautiful trails in Westchester with deer and rabbits and foxes and fox. So I one day just said, I'm going to be present to all the beautiful things around me. And I shifted my focus. I reframed the situation. And again, I just absolutely love running. And then there's a healthy diet. We're going to speak about this in a bit of detail, along with staying hydrated that help the body manage and reduce anxiety symptoms. And then, of course, there are social supports. These are the alternative therapies, you might say. Connecting with friends, family, support groups can help individuals feel much less isolated and just better equipped to manage anxiety. So in the notes, which again you'll find at drmichaelwald.com on the website, you'll find several references that support everything that I'm saying basically in this podcast of Anxiety Answers. For those of you just joining us, you're listening to Ask the Blood Detective. This is Anxiety Answers, the topic of our show today. You can reach me at info@blooddetective.com. My email is drmichaelwald.com, and the phone number is 914-552-1442. So let's speak about natural and nutritional treatments for anxiety. So I mentioned this relaxing or parasympathetic supportive nutrient or neurotransmitter just a few minutes ago called GABA. Remember? GABA, gamma amino butyric acid. You can get this non-prescription, and it's also a prescription drug. And what you need to know about GABA, I want to spend a little bit of time on this, just a minute or two, because it's that important, and it's almost completely ignored these days in medicine, except by neurologists who use it for neuropathic pain. What I love about GABA is you can take very high amounts of this in the 2,000 plus milligram range with very few or no side effects. We need GABA to promote what's known as positive neuroplastic changes in the brain. When the brain breaks down and it ages and it's experiencing anxiety, there is a lowering of GABA levels in the brain. GABA helps to elevate mood, it helps pain, and it helps sleep. And it's been proved to help anxiety and depressions, and with a wide range of safety, particularly compared to some of the other medications out there now. It's not the best fit for everyone, but you need to know about it, because if you mention this to your doctor, they generally consider GABA pretty harmless, so they probably would give it to you. So what is it? It's a neurotransmitter. It plays a crucial role in regulating brain neurochemistry, particularly GABA levels, so it's going to help reduce anxiety and promote relaxation. It's produced in the brain and acts as an inhibitory or calming neurotransmitter, which means it reduces the activity of neurons in the brain. And this helps to calm the brain and the nervous system, and that is how it results in reduced anxiety and stress. So there are nutritional supplements containing GABA or just pure GABA that can be very beneficial for individuals experiencing anxiety. And the supplements are available in tablet form and capsules and powders. And the range dose should be somewhere between 250 and 1,000 milligrams. It could be double that, by the way. But if you're going to take GABA, but you're on, let's say, on SSRI medications, the serotonin reuptake inhibiting medications, and if you're also adding tryptophan, you're going to be taking multiple things that could potentially increase your serotonin, and you can develop a deadly condition known as serotonin syndrome. You might want to look that up on my website at drmichaelwald.com. So it's very deadly, and people just don't know. They just pile on the different things that promote serotonin, and it can be extremely dangerous. And again, on the website, I've given some more details about GABA. Please do look at that. Let's move on to the next nutrient that's really important for anxiety and just overall health, and particularly brain function, are omega-3 fatty acids or fish oils. There's been easily 75 years of studies on omega-3s in a variety of conditions, including anxiety. So most everyone knows that omega-3s are found in fatty fish like salmon, sardines, and mackerel. And some of you with more knowledge out there are thinking, well, which one do I have? Aren't these fish contaminated with metals? And you'd be right. Most of these fish are not only contaminated with metals, but also arsenic, which is a toxin, obviously, and even microplastics. But there are ways of sourcing fresh omega-3s, particularly in supplement form, that has been checked for microplastic content, has been checked for heavy metal content. But for now, you need to know that omega-3 fatty acids are in fish, and salmon is the highest amount. But if you cook that salmon or cook the fish too much, you're going to burn out and oxidize all of the omega-3s. You really do want to take supplements in addition to dietary sources of omega-3s. Because with supplements, you can get much, much more omega-3 fatty acids in a if you choose the right company, in a pharmaceutical grade, is what I meant to say. So we know omega-3s are needed for brain health, and omega-3s help regulate a variety of neurotransmitters that help reduce anxiety symptoms because they help mood regulation. And then there's magnesium. Most of my clients seem to know about magnesium. They're taking the wrong doses, they're taking the wrong forms, but at least they were on they're on the right playing field. So in order to figure out the right form and dose of magnesium and the timing, that has to be done per individual. But you need to know that magnesium is essential, and it's involved in over 300 biochemical reactions according to some sources. I've seen other scientific sources that say it tops over 500 different enzymatic and other reactions in the body that will not take place properly without magnesium. And many of them have to do with mood regulation and helping reduce anxiety. So there are lots of studies that I've read over the last 3 decades of my career, not to mention just clinical experience, which has suggested to me that magnesium deficiency absolutely contributes to anxiety symptoms. And if you want to start by consuming magnesium-rich foods, some of those would be almonds, spinach, avocados, dark chocolate, and magnesium supplements. Now remember, I'm not telling you to eat tons of dark chocolate. There's a little bit of magnesium in there. People always bring this up, which is why I'm bringing it up here. But no, I do not recommend people to eat dark chocolate to get their magnesium levels. And the almonds, by the way, should be raw and organic. And then there are B vitamins. So B vitamins, particularly B6, vitamin B9, which is folic acid, which increases serotonin in the body as well, along with B12, are essential for brain function and for the production of a variety of neurotransmitters, particularly serotonin and dopamine. Those are the ones that you want to have increased when you use your nutritional efforts to improve mood and reduce anxiety. Low levels of these vitamins in the diet, they don't even have to be deficient levels, meaning like they're like off the charts too low. They could be insufficient, meaning normal levels, but not enough for you. Look, when you experience life, stress, disease, what have you in your life, you might need levels of nutrients way beyond the recommended daily allowances, way beyond the recommended daily intakes, whatever you want to call it, simply because of your stress. Just like the stress of someone who exercises will require far more protein and antioxidants than someone that does not. So you don't want to be comparing your levels of nutrients to normals because, number one, you might need much higher to get into the range of optimally normal for you. More about that, by the way, in my autoimmune seminar, or with our seminar notes on my website at drmichaelwald.com. And also there is at least 1 or 2 other podcasts which talk about that more. And then there's something called L-theanine. So L-theanine is an amino acid. It's found in green tea. It's been, you want to get decaffeinated green tea, obviously, right? And the L-theanine has been shown to promote relaxation without causing any drowsiness. And one of the ways it does that is by increasing the levels of GABA. Although if you take too much GABA for you, you will experience a drowsiness, which is why you want to take GABA most likely before bed. Sometimes I'll have my clients take a small amount of GABA in the morning. If they are able to take another small amount in midday, that shouldn't knock them out. And then they take the higher dose before bedtime because it will help sleep as well. And then you'll have a nice even kill for the next day as you just take your GABA regularly to keep your neurochemistry balanced. Does GABA work for everyone? Does L-theanine work for everyone? Do B vitamins and omega-3s work for everyone? No. But usually there is a combination of these that does help. I base the dosing, everyone, on body composition. What is your lean mass? Look, if you're a big person, you're probably going to need larger doses. That's all I'm really saying. But I want to know the amount of lean mass on your body because that more accurately lets me know about dosing. So the doses that you'll find on the bottles or the containers for all these nutrients I'm recommending, they're just the minimum amounts that have been put there by various nutrition companies that don't know you. So if they don't work when you try them, it's not because they couldn't have worked. You just may have done the wrong dose, the wrong combinations of nutrients. The timing may be wrong. All of that can be worked out with a qualified healthcare provider. And back to the L-theanine, which helps upregulate or make more GABA, which has a calming effect on the brain. I mentioned that drinking green tea, which does also contain some L-theanine, can help reduce anxiety symptoms. And then there's ashwagandha. It's what they call an adaptogenic herb. It's ancient. It's been used in Ayurvedic medicine since the beginning. As far as I'm aware, it's been shown to reduce stress and anxiety by regulating cortisol levels. And cortisol is a chemical released, a steroid chemical released by the adrenal glands in the body when the body perceives stress. And there used to be commercials on high cortisol levels and belly fat, which is somewhat true. But ashwagandha supplements being adaptogenic means that if your anxiety is too high, it brings it down. And if your mood is too low, it brings you up. Ashwagandha does powerfully affect the thyroid gland, so do not take this unless you are either getting thyroid testing done or there's some other good reason why your doctor doesn't think that needs to be done. And then there's passion flower, which also increases levels of GABA. That's what I'll say about that for now. And then there's lavender, which is a fragrant herb. It's known for its soothing properties. Sometimes just putting a little bit of lavender on your wrist and then taking a little whiff of that can calm a person down, particularly if you are mindful of that. So, for example, if you think about lavender as calming and you smell lavender when you happen to be in a calm mood, and you repeat that, that's exposure therapy. And then you find yourself feeling anxious or experiencing anxiety attack. Sometimes but just by smelling lavender, you instantly change your biochemistry. It can put you in a much more resourceful state and lower anxiety and stress levels. And then there's chamomile, which is it's a gentle herb, often consumed as a tea to promote relaxation. Is that going to magically cure your anxiety? Probably not. But if you take the tea at a regular period of time and you whiff a little lavender and you take some of these other nutrients based on what your chemistry says you need, you're going to do pretty well, most likely. And then there's valerian root. It's an herbal remedy commonly used to treat insomnia and anxiety. And it also may increase GABA levels in the brain for some people, which is very, very important. And what's another good one I can mention? Oh, yeah, there's a few I'm thinking of. Lemon balm also. It's a mint in the mint family. It's been used for centuries to reduce anxiety. It does that also by boosting up GABA levels. Sometimes you'll want to just take GABA. Now, that might work well for you, but other times you might want to take GABA with a combination of herbs that also increase GABA levels, because when the body naturally increases the GABA levels, that may work better than if you sort of artificially increase the GABA levels by taking it. So, but the exact opposite I have found is true in other people too. So I just want to make you aware that sometimes you might want to just take GABA. Other times you might want to take herbs like lemon balm and the others I mentioned that will naturally increase GABA levels. And sometimes you want to do a combination. And also, depending on the individual and the rest of their health and other medications they're taking, I mean, many people have comorbid conditions, right? We all learned that through COVID. I might not choose GABA at all for a particular person, and there would be good reasons for that. And then there's inositol, which is a naturally occurring compound in fruits and beans, grains, and nuts. And it has a well-established role in neurotransmitter signaling. And then, of course, there's vitamin D, vitamin D3. Vitamin D has been associated with an increased risk of anxiety and depression when levels are low or not optimal, meaning your doctor can say you have normal vitamin D3 levels, but they may not be normal enough for you to feel less anxious. And then there's zinc, a mineral involved in brain function. Low levels are associated with anxiety disorders. So you definitely want to have spinach and pumpkin seeds and organic farm-raised beef and oysters. These are zinc-containing foods, and sometimes people need a supplement. And then there's probiotics. This is fascinating to me. We all know about probiotics for gut health, right? The gut-brain connection suggests that a healthy gut microbiome, that's the environment in your intestinal tract, might positively influence mental health. Probiotics, which are beneficial bacteria, they can help maintain a gut environment, a healthy gut environment, and reduce anxiety symptoms because, for a number of reasons. One of the reasons, which is very interesting, is that certain types of probiotic bugs can increase serotonin levels in the brain and also serotonin levels in the gut. And interestingly, the intestinal tract produces more serotonin than even the brain. So they call the gut these days the second brain. And you've heard this before when someone says, I have a gut feeling about something. There is a connection, not just an anatomical connection, but a biochemical connection and an energetic and a mental, emotional connection between the brain and the gut. The choice of which probiotics I give a person are, again, very precise, so I can't give you specific recommendations here. And even if you Google which probiotic organisms are best for anxiety as opposed to gut health, you might get some answer. But you have to realize that information has to apply to you. So what is your chemistry like? What are your medications like? There's a lot of things to consider. And then there's vitamin C. That's a potential antioxidant. We know it plays a role in managing the stress response. It impacts the production of serotonin and also norepinephrine and epinephrine and a neurotransmitter known as L-DOPA. So you want to have a lot of vitamin C-rich foods. You're probably going to need to take a supplement of vitamin C. The type of vitamin C you need, some people need acid vitamin C, which is ascorbic acid. Other people do better with buffered ascorbate. Okay, and it's very interesting to note that vitamin C is stored in high concentrations in the adrenal glands. So we have two kidneys in our bodies, which are the size of our fists. If we curl our fists up, like to make a punch, that's about the size of your kidneys. And your thumbs are about the size of your adrenal glands. And those adrenal glands are the filter for stress, mental stress, emotional stress, physical stress, the stress of exercise, the stress of not exercising, the stress of repairing, the stress of disrepair, stress, all of it gets filtered through the adrenal glands. So you have to make sure that your vitamin C levels are ideal. Okay. And then there's ginkgo. That's an herb, right? That is from the ginkgo tree. It's been used in traditional medicine to improve cognitive function and to reduce anxiety symptoms because sometimes anxiety symptoms in the brain are caused by lack of blood flow to certain areas of the brain. And ginkgo, there's a white paper on ginkgo, which is a paper which explores the true science around this, and it absolutely does potentially increase blood flow to the brain. And I'll just rattle off a couple of others without giving you much explanation as to exactly how these work today, just based on time. But you can go to my website, again, at drmichaelwald.com and look these up. They would be kava, St. John's wort, which you absolutely must make sure there are no adverse drug interactions between St. John's wort and the drugs you're taking. And then I mentioned the exercise and physical activity and the importance of that. And I just want to emphasize, too, that there are two fundamental assessments that a good practitioner should do for every patient who wants to successfully manage their anxiety. One is a test of absorption. Because let's say we figure out we want to try all these different nutrients on you in foods and things like that that are affected by your absorption. If you malabsorb, if you are failing to absorb fully, then when you take a certain dose of something, you're not going to absorb that dose. It's going to end up as some other unknown dose. Then you're going to wonder why things aren't working. But if I know, for example, that you malabsorb by 50%, I might increase your doses by 50% to offset the loss of what you're not going to absorb. So there is the malabsorption absorption test. And the second important test is a body composition test. That's a test which measures the percentage or percentages of muscle, water, and fat on the body, also intra and extracellular water balance, something called phase angle, and a bunch of very, very important and essential biomarkers. In fact, everyone, a body composition test, which is also called a bioimpedance test, is the single most important biomarker that predicts lifespan and health span. So health span is how long a person lives free of diseases that could compromise themselves or symptoms. And obviously, lifespan is lifespan. So body composition and a malabsorption absorption test. In a few moments, when I end the presentation today, I'm going to review with you my most important lab test that I think you need to be mindful of when it comes to assessing your own chemistry for missing elements or insufficiencies or just outright deficiencies of either protein, carbs, and fats or vitamins and minerals that you must have for successful anxiety treatment. Another question I'm asked about more and more, because I am a life coach, is what are the differences between, let's say, life coaching and psychological counseling for anxiety and mental health problems? Now, practitioners are going to have different opinions on this, but I tried to be very precise here in terms of what are the things that we know, which are the standards of how to separate these things out. And I think you'll see what I mean in a moment. So in other words, it's not just some arbitrary opinion of mine. This is the difference between anxiety and life coaching can be found in the literature. So life coaching and psychological counseling are obviously both methods of that support and aim to help individuals deal with a variety of issues, anxiety, and a whole host of mental health problems. But they do differ in their goals and techniques sometimes, although there is some overlap. So for example, life coaching focuses on setting goals and achieving them, while psychological counseling addresses the root causes of mental health problems. Health coaches work with clients to identify their strengths, their weaknesses, and obstacles, and then develop strategies to overcome them. On the other hand, psychological counseling is much more focused on understanding the underlying factors that contribute to mental health issues, such as traumas or genetic predispositions. Now, although I've sort of tried to separate out the general approaches between life coaching and psychological, the truth is that both psychological counseling and life coaching, and this goes, by the way, for everything I'm about to say in this area, they actually both do a lot of these things. So these are artificial separations, more or less. You'll find different practitioners for life coaching and psychological counseling that have their own preferences as well. But at least you'll know what's out there. Now, in terms of goals, the primary goal of life coaching is to help clients achieve their personal and professional goals. So that might include improving relationships, increasing productivity, or developing, let's say, better communication skills. In contrast, psychological counseling aims to help clients manage their mental health problems such as anxiety, depression, and addiction by addressing underlying causes and providing coping strategies. But as I said, life coaching also does that. There may be certain techniques, though, that are more or less used by therapists that are not used by life coaches and vice versa. But you can only know that once you meet the individual life coach or counselor and to see if they're a good fit for you. Now, regarding techniques, life coaching techniques include, again, setting goals, identifying obstacles, problem solving, and providing motivation and support. So coaches use various tools and resources to help clients achieve goals, such as setting what's known as SMART visualization or SMART goals and using visualization techniques. When I say SMART, that's an acronym for specific, measurable, achievable, relevant, and time-bound goals. Then there's psychological counseling techniques involve psychotherapy, cognitive behavioral therapy, the CBT I mentioned, and other evidence-based practices. And these approaches and others used by psychologists help clients understand how their thought patterns and behaviors contribute to their mental health issues. And then they can work together with the counselor to develop coping strategies and make lasting changes. If you can't bring a problem to the surface, and if you can't articulate what the problem is, it's going to be very difficult to provide specific treatments. In fact, this doesn't just happen with some people with anxiety, but other mental disorders, certainly schizophrenia, but even something like depression. When I ask a person what their concerns are, let's say what do they think what is it in their minds that they think is causing their depression or anxiety, many of them can't articulate it. They say, I don't know, maybe it's this, maybe it's that. And when a person cannot articulate that, that means they simply don't have the word tools to clearly define what their needs are. And if you can't do that, then how can you focus your attention on the needs if they can't be articulated? So that's what either life coaching or various psychological approaches do, among other things. They help a person clarify what needs to be managed. And then there is duration and frequency in terms of, how often and how long should you receive either life coaching or psychological counseling. And, it goes all over the spectrum. Life coaching sessions might be shorter and more frequent than psychological sessions, but not always. Life coaches might meet with clients weekly or biweekly or for a few months or even years. And the same thing with psychological counseling. And the time of the sessions, they might be about the same, 45 to 60 minutes. It just depends. And then in terms of who are these professionals, so life coaches are not required to have formal education or licensure, at least not in New York State. And that may have, although there may be, and there are, relevant training and certifications that life coaches get. They're just not recognized by the state. That doesn't mean they're not valuable. And in many cases, they're more valuable, in my opinion. Psychological counselors, on the other hand, are required to have a master's degree or higher in mental health, in the mental health field, and they need to be licensed by their state or province. So in conclusion, life coaching, psychological counseling, they're distinct methods of support, with each offering its own unique and sometimes overlapping approaches to helping individuals with anxiety and mental health problems. I suppose it's fair to say that life coaching is more focused on goal setting and achievement, while psychological counseling addresses, I would say, the root causes of mental health issues and provides evidence-based techniques for coping and recovery. But quite honestly, life coaches do that as well, and vice versa. And again, I've provided some references in the notes on the website for you to look at too if you doubt any of this. So now let's look at the lab test. This is the end here now, so hang in there. You've made it this far. You've learned a lot of details, and I would say the detail of this presentation is probably one of the most detailed and practical ones I've ever done. And I felt it was so important because the mental emotional problems that we have, they are sometimes far more difficult to manage successfully than, ingrown toenails and other physical health problems. So I almost rather would have something be a physical problem where it's obviously physical and you fix the physical thing and the whole problem goes away. Sometimes that happens with anxiety, and sometimes it doesn't. Knowing what tests to do will help you get closer to the biochemical needs of that person with one or more forms of anxiety, and that is what you want. So there is a testing panel known as CMP, or a comprehensive metabolic panel. It's a basic panel along with a CBC, a complete blood count, which every doctor tends to do. Certainly every family practitioner and every internist as basic. So the Comprehensive Metabolic Panel, or the CMP, is a blood test that measures various chemicals, including electrolytes, which are calcium, magnesium, sodium, phosphorus, glucose levels, something called a BUN, B-U-N, or blood urea nitrogen, which can tell you about renal function or under hydration, There's creatine, also a renal function test or kidney function test, and liver function test. So all of these tests help assess, as I mentioned, kidney, liver, overall metabolic health. It also checks various nutritional imbalances. And I should mention that as the original blood detective, that's me, okay? I wrote a 500-page textbook on the nutritional and medical interpretation of laboratory tests. And when I look at the results of your testing that, let's say, you might get at your doctor's office or by me, I don't just read the testing by comparing you to the ranges that the lab gives me. In other words, if you get a cholesterol test, the range is somewhere about, let's say, 100 to 200. And you might be 199, that's considered normal. And you might be 165, that's also in the normal range, right, of 100 to 200. But isn't 165 probably better in terms of reducing your chance of getting a cardiovascular problem like a heart attack or a stroke than 199? The answer is of course. So there is an optimal place of cholesterol at about 165. But most doctors that are traditional doctors, not most, all of them, will look at that range, and you could be a 101 or 199, which is normal, and then you're 201, then you're abnormal. But if we know that the higher normal you get, the increased risk of you dying, then maybe we want to keep you at 165. We know, for example, and you'll find this in my book and other lab books, that cholesterol levels at 160 or lower increase cancer risk. And cholesterol levels above 200 increase cardiovascular risk. Almost no one is told this. I've had patients come in very happy saying, oh yes, my cholesterol's 160, and my doctor said it's fantastic. But they've got these hormonal problems, and they don't even know that that's linked. For example, if you don't have enough cholesterol, you can't make pregnenolone, you can't make progesterone, you can't make enough adrenal hormone DHEA, you can't make enough estrogen. So it's important to know to do a nutritional interpretation, which I have originated, which allows me to go and look at your labs and say, okay, so what is the range based on what your doctor says, which I also read, and then I say, well, what is the range which is the healthy place to be in all of the tests that we're doing? So for everything in the comprehensive metabolic panel, there is a normal result, but then there's an optimal result. Let me give you an example, vitamin D. So that's a very important test for immunity, for bone health, for just overall sense of well-being. We know that low levels of vitamin D are associated with anxiety and depression. Now, the vitamin D levels are 30 to 100. Most doctors will look at you in the face and say, you're 31, you're fine. If you push them, they'll say, well, we really want you at a 50. But if I pushed it, I'd say we want you to be at a 70, because there was a study of all the good studies of vitamin D3 that were done called a meta-analysis, and it says the higher normal your vitamin D3, the lower your risk of dying of anything. So the optimal vitamin D is a 70. The normal range is 30 to 100, and most doctors accept anything over 30 without any consequence. And then when your vitamin D3 levels are low, most physicians, because they're not trained in nutrition, prescribe vitamin D levels way too low. Some doctors have literally said to my clients, just take vitamin D, and they have to make up their own dose. Others that are a little smarter, the doctors, will say, well, take 500 IUs. And if they're really smart, they'll say, you're low, you're less than 30, you need to take 50,000 units of vitamin D IUs, 50,000 IUs, once a week for 2 months. Then you recheck it, and then you might use lower amounts to move you more gradually to the 70. And then there are thyroid function tests. By the time your doctor says to you, oh, your thyroid tests are abnormal, or one of them is abnormal, or two of them is abnormal, you have to lose about 40% of your thyroid function for the test to show anything. So they might look at it and say, oh, you're just a little out. That means 40%. But the doctors aren't remembering this, because the last time they learned labs was probably 20, 30 years ago in school. There are normal ranges of thyroid tests, and there's several thyroid tests, thyroid hormones, T4, T3, free T3, TSH, etc. And then there are optimal places to be in that range. If you look up on my website, how to interpret your blood work, it'll come up, and you can listen to more about that. I've done very detailed podcasts on blood interpretation. And then I mentioned earlier, real quickly, the complete blood count, or the CBC. So that test measures various components of the blood, including red blood cells, white blood cells, and platelets. So low levels of certain nutrients like iron and B12, they can lead to anemia and also depressed mood. And the CBC can help identify nutrient deficiencies, which can help the practitioner know what dose to take. And again, all of this interpreted based on how you compare to average people, which are the ranges your doctor uses, and the average person is not so healthy. And then there are the healthy ranges. Then there is a bone mineral test. Why am I talking about a bone mineral test with anxiety? Well, the bone mineral test measures bone density, which obviously is important for osteoporosis. But that also might mean that the person is calcium deficient. And everyone, I need to let you know, if you're calcium deficient, you don't necessarily just want to take calcium. You want to ask, well, why are you calcium deficient? Sometimes it's because you need more calcium. The other instance would be if your body doesn't activate calcium properly, because when you consume calcium, the stomach acid in your stomach activates or ionizes the calcium, and it's ionized calcium which knows what to do in the various body areas. It's needed to calm the nervous system. So that's the calcium, bone density, anxiety connection. We need calcium for blood clotting. And we need calcium for neuroplasticity, which is proper healing in the brain. I do a bone density test on anyone older than 50, along with a vitamin D and ionized calcium blood testing. Most doctors do not even check ionized calcium. They just take calcium. And if you ask them, why don't you check the ionized active calcium? They'll just look at you funny because you're not supposed to know that. And the answer is they should be checking the ionized calcium because that's the usable calcium. And then there's magnesium testing. Magnesium is involved in over 500 biochemical reactions, and low levels will mess with your nerve function, your muscle function, and your energy production. Low magnesium has been associated with lots of mental health disorders, certainly depression and anxiety. So sometimes you might want to use a serum test for magnesium if you want to know what the last 3 or 4 days, 5 days of a person's magnesium intake has been. Or you might want to do a white blood cell test, which gives you months of average of what their magnesium might be. And then there are different types of magnesium aspartate, magnesium citrate, magnesium glycinate, just to name a few, that are more or less good for different people depending on their entire health picture. And then there's what's called a homocysteine test. So homocysteine is an amino acid. By the way, any doctor can check this. It's a non-fasting modeled top blood tube, by the way. When they tell you, well, I've never heard of it, I don't know how to test it. Oh, doc, it's this, a modeled top red tube, non-fasting. That's how you do it, which every doctor has in their office. So homocysteine may be elevated in the presence of several nutrients that are essential for mood, like B12 and folic acid. I mentioned earlier that folic acid produces serotonin in the body, and then folic acid and B12 should almost always be taken together. But elevated homocysteine, it's a toxin, homocysteine, has been associated with anxiety and depression and heart disease and cancers and autoimmune diseases. So by measuring homocysteine, your healthcare provider, if he or she is knowledgeable enough, can help identify potential imbalances in these nutrients. Just 2 more or 3 more. Then there's zinc. So zinc is needed for about 250 enzymatic reactions. We know it's important for immunity. Almost everyone knows that. They take zinc when they have a cold or they feel sick. And it's needed for growth and just body development. Low levels are associated with anxiety. That's very, very common. And there's something called a zinc taste test that if you don't taste zinc sulfate on the mouth right away, you're deficient. And the longer it takes for you to taste it, either a metallic-y, fuzzy, or metal taste, the more deficient you are. Now, the zinc taste test it's not 100% accurate, but when compared with other tests, it can be extremely useful, and it's super cheap, and it's very quick. The test takes less than a minute. So in terms of zinc, you could do a blood test. You can do the zinc taste test. Even the speed of white blood cells under a microscope, which are zinc dependent, can tell you if a person needs zinc. But ultimately, if you take a safe amount of zinc, which is between 25 and 50 milligrams, and you feel better, that's the best test. And then there's iron. So iron's a mineral which is needed to produce red blood cells. And without red blood cells, you can't transport oxygen throughout the body. And low levels of iron are, by definition, anemia, which can affect a person's energy levels and mood. So a blood test can measure iron levels, whether it's a hemoglobin hematocrit, TIBC, or percent saturation. Don't be thrown off by me rattling off these tests. If you just ask your doctor for a iron panel, it will include serum iron and ferritin and hemoglobin and hematocrit and these tests. They're not always needed when assessing iron. It really depends. I would say you do a hemoglobin hematocrit test and a serum iron, and if you have deficiencies there, then you probably want to do a ferritin test, which tells us about long-term storage of iron. Serum iron is just a handful of days. And again, a blood test that measures iron levels will help you know how much iron to give, because iron anemia, just like protein anemia or B6 anemia or B12 anemia or folic acid anemia, all of those nutrients are essential, more or less, for managing anxiety in each individual. And the last thing I will say today, is a urinary cortisol creatinine ratio, or UCCR. Cortisol is a stress hormone, and it's elevated in most people with anxiety. It's hard to experience anxiety and not to have elevated cortisol levels. They might be in the normal range, but they may be on the high side of normal. Or what if your cortisol levels, let's say I'm going to make this up just for the purpose of example. Let's say your cortisol levels are 10 to 50. Let's say 10 to 60. Now, you might normally hover around 20 or 30, and you might have anxiety. So lowering you to a 10 to 20, lower than your average, may help you. You don't have to have 30 as a level for you to experience cortisol. Other individuals may have high levels of cortisol or high normal, and they don't experience anxiety. That's just because of how their receptors for cortisol behave. But you might hyper-respond to a low level or a lower than optimal level, let's say, and that you can have anxiety. So if you have anxiety and you have some imbalance you have a certain cortisol level, the general rule is you probably need less of that cortisol. Okay? So once again, cortisol is a stress hormone. It's known to be elevated most of the time in individuals' anxiety. And the urinary cortisol creatinine ratio measures the ratio of the cortisol to creatinine in the urine. So elevated cortisol can indicate chronic stress. It may contribute to anxiety symptoms, as I've mentioned. And by assessing the UCCR, the urinary cortisol creatinine ratio, UCCR, qualified healthcare professionals can identify potential stress-related factors. And then once they have you do all these things, you eat better, you take your supplements, you might do a CBD therapy, all these different things, then we would want to see the urinary cortisol level get to a place where, we'll see where it is when you're not feeling anxiety, and that's how we know it needs to stay. Woo, that's a lot, even for Ask the Blood Detective. But again, I thought that this was very important. The number of emails I've received and phone calls for this topic was stressing me out, honestly. No, just joking. But made me realize that this is something that needed to be covered. So once again, for more details, to get the notes for the show, just go to the website at www.drmichaelwald.com. You email me your comments and questions at info@blooddetective.com. And feel free to call me if you want to become a client at 914-552-1442. I'm Dr. Michael Wald, the Blood Detective. You're listening to Ask the Blood Detective, and I'll see you next time. Take care, everyone.